Reflecting on the last 8 months, how has COVID-19 impacted your BME communities?
I think it's been a very, very challenging period for all of us. And I would say, with respect to our BME community, they have been impacted and felt the challenge probably greater than other sections of the community. There are challenges about BME communities accessing health and care services. So we made sure that we had information available in a range of languages, in a range of different accessible formats. For my staff directly in the council, well, a lot of that workforce work with the most vulnerable people and are at a higher risk COVID impact. So we've worked really closely with those care sectors to ensure the staff who work there are as protected as possible, be that through PPE, the safety equipment people wear, and as far as advice and information is concerned.
So when you look back to the start of the pandemic and with the George Floyd and Black Lives Matter movement, how do you think it affected your communities, our communities in Sussex?
It's frustrating that the progress hasn't been made that we feel should have been made over the last 30, 40 years. And It's been a wake-up call to all of us. Actually, the fact that there is still systemic racism that needs to be tackled is still so prevalent is a real worry. I think the Black Lives Matter movement mustn't be allowed to take a second place in this new world that we're all working. It's got to be right up the top, and we should make sure that the changes that we are working towards in the future as to how we work and how we look after people is part of underpinning our everyday practice.
How would you implement procedures against systemic racism? So what would you do to combat it?
On racial equality, whilst we had made some progress, we hadn't made the progress we hoped we would make in all areas. And we're making sure that those action plans transfer into meaningful action. So to become a fully anti-racist employer with equality at the heart of everything we do. We know already a number of them will be around information, around training, around raising awareness across the whole of the workforce as to what the issues are that the BME community face on a daily basis. And then that for those particular cohorts of my workforce and the communities out there, that they access support that is required to help them in the workplace.
Looking to the future, what action will you take in the next 6 to 12 months to ensure your BME staff or communities thrive?
At the moment, we're in Black History Month, aren't we? So in this month, lots of things tend to happen. Beyond that, though, it's about making sure that it doesn't then just get forgotten at the end of Black History Month. It's about ensuring that we're doing this on an ongoing basis. I will engage on a regular basis with my BME workers. I will listen to them. I will hear what they have to say, and we'll take forward actions as they come forward to ensure that the opportunity for those workers to work in a much fairer place are realised. So one of the key things I will do is ensure that I communicate with the care home sector and the home care sector to ensure that they understand how their workforce is feeling directly. And so we work together as a system to try and improve things for the future.
Expanding on that, how would you know the procedures you put in place to combat racism have worked? How would you know that you have achieved something?
I will be ensuring over a period of time that we keep those action plans updated, and we talk to our Black workers about whether they feel it's improving. Because fundamentally, the key measure will be this time next year, does our workforce and do our communities feel that things are better than they are today?
And finally, how will your staff know they're being supported? So what will you do to make they are in a safe working environment?
They'll know when they see things are getting better, when they see the actions they have asked for are being implemented and delivered. In the context of COVID-19, when they see that the concerns around why the BME community has been impacted more than other communities are being directly tackled. That's one. The second one that I do personally is to make sure I communicate to all our staff and the BME workforce in particular, in that, about what we've heard, what our concerns are, and what we're doing about it.
Racism nowadays is less direct, it's more subtle. It's more like that hint of you're being disrespected, but they're not fully letting that out.
So I think what underpins this is trust and relationships. Then they're more likely to be open, and we're going to have a greater chance of actually moving this forward. We have a directorate equalities group that feeds into a corporate equalities group for the council. So each directorate has that, and we cascade down into our workforces to make sure that we are representative in what we're discussing.